guys, I am CALCITONIN, one of the drugs acting on the endocrine system, and for today's video, we're going to tackle about my autobiography. So let's start this discussion with my drug name. My chemical name is calcitonin salmon. My brand names are Mayacalcin, Fortical, Calcimar, and Salmon 9. And my chemical name is C145H240 and 44O48S2. Let's go now to my drug classification. For therapeutic classification, I am an anti-hypercalcemic agent, while in pharmacology, I am a thyroid hormone. I know you are all wondering if I am safe to be taken by a pregnant woman. Am I safe? Well, the answer is no, because my pregnancy category is pregnancy category C, which is there is no adequate studies conducted on pregnant women. Thus, this drug should be used during pregnancy only if the benefits to the mother outweighs to the potential risk if this is taken. Let's go now to my mechanism of action. How does I work in your body? Well, I am a hormone that is secreted by the thyroid gland. I also help to balance the effect of the parathyroid hormone and act to inhibit the bone resorption of calcium in the body, which changes the transport of calcium and phosphate across the plasma membrane in the osteoclast. I also inhibit the resorption of phosphate, sodium, and calcium from the kidney, thus decreasing the calcium level of the patient. Let's go now to my pharmacokinetics. For my absorption, the plasma levels of 0.1 to 0.4 mg per ml are achieved within 15 minutes of a 200 IUSC dose. The maximum effect is seen in 2 to 4 hours. The distribution is unknown. My metabolism, rapid metabolism occurs in the kidneys with additional activity in the blood and peripheral tissues, while the excretion, I am excreted in urine as inactive metabolites. As you can see in this table, this will be my route, onset, peak, and duration, and also my half-life. Let's tackle about my indication. I am a drug that is used to treat many problems with the bone, for example, Paget's disease and postmenopausal osteoporosis, and to reduce calcium levels that are high in the blood. Calcitonin is a man-made hormone that acts in the blood by slowing the loss of bone and preserving regular levels of calcium. In individuals that have Paget disease, it can also help to relieve bone pain. Of course, when there are indications, there are also contraindications and cautions present. The following are contraindicated to take this drug: to lactating mothers, those patients that show allergy to salmon or fish products, those patients who are diagnosed with hypocalcemia, and if the therapy is a must, this needs to be corrected before initiating the therapy, and lastly, to patients with pernicious anemia and renal dysfunction. Let's move on and decide on adverse effects that I can give to those patients who will take me. Yes, I have cited adverse effects that I will give to you that you can experience and can alter the status of your body. First, in the cardiovascular system, the patient can have chest pressure, dyspnea, and edema of feet. In the special senses, the patient may experience eye pain and nasal congestion. Next in line is in the central nervous system, the patient may feel dizzy, experience headache, paresthesia, or weakness. The fourth one, in the urinary system, the patient will experience nocturia and increased frequency of urination. Another system that will be affected is the digestive system, wherein the patient will have diarrhea, anorexia, abdominal pain, transient nausea, unusual taste, vomiting, and epigastric discomfort. And for the integumentary system, the patient will have facial flushing and pruritus of earlobes can be seen. Another side and adverse effects are anaphylaxis, chills, and tender palms and soles. Let's discuss about the nursing responsibilities before, during, and after taking me. Before, The nurse needs to assess for contraindications or cautions, history of allergy to drug or to fish products with summoned calcitonin to avoid hypersensitivity reactions, and also to the patients who are pregnant or lactating and with those who have hypocalcemia and renal dysfunction. Also assess for the presence of any skin lesions, orientation and affect, abdominal examination, serum electrolytes and renal function test to determine baseline status before beginning therapy and for any potential adverse effects. During the therapy, the nurse needs to ensure adequate hydration of the patient when administering calcitonin to reduce the risk of renal complication. Also arrange for concomitant vitamin D, calcium supplement, and hormone replacement therapy if used to treat postmenopausal osteoporosis. Rotate injection sites and monitor for inflammation if using calcitonin to prevent tissue breakdown and irritation. Monitor serum calcium regularly to allow for dose adjustment as needed. Assess the patient carefully for any potential drug-to-drug interactions if giving in combination with other drugs to prevent serious effects. Arrange for periodic blood tests of renal function if using gallium to monitor for renal dysfunction. Provide comfort measures and analgesics to relieve bone pain and if it returns as treatment begins. Lastly, provide thorough patient teaching, including measures to avoid adverse effects, warning signs of problems, the need for regular evaluation if used for longer than recommended, and proper administration of nasal spray to enhance patient knowledge about the drug therapy and promote compliance. After the therapy, the nurse needs to monitor the patient response to the drug, such as the return of calcium levels to normal, prevention of complications of osteoporosis, and control of Paget's disease. Also monitor for adverse effects such as skin rash, nausea, vomiting, hypocalcemia, renal dysfunction, and monitor length of biphosphate use. Also evaluate the effectiveness of the teaching plan and if the patient can name the drug, dosage, adverse effects to watch for, and specific measures to avoid them. Lastly, the nurse needs to monitor the effectiveness of comfort measures and compliance with the regimen.